This video is for educational purposes only. The information in this video is provided with the understanding that the groups involved are not engaged in rendering medical advice or recommendations. The information provided should not replace consultations with qualified healthcare professionals to meet your individual medical needs.
Hi, I'm Anthony Henry, president of the Walnut Foundation in Toronto. Today, the Active Surveillance Coalition is presenting another installment in its AS101 series. The topic is exercise and active surveillance. The AS Coalition is comprised of ASPE, the AS group within ANCAN, the Active Surveiller newsletter, Prostate Cancer Support Canada, the Walnut Foundation, and PCRI, which has helped in filming and editing these webinars. This webinar series features Larry and Nancy, a couple from New Mexico, who have been on this prostate cancer journey and are our model patient team. They're discussing topics of interest to newly diagnosed Gleason 6 low-risk prostate cancer patients and those who want to review the basics. They're visiting with Dr. Kerry Courneya, professor and Canada Research Chair in Physical Activity and Cancer at the University of Alberta in Edmonton, Canada. His research focuses on physical activity after a cancer diagnosis, or exercise oncology. He and his group are the first to show that exercise can slow the advance of low-risk prostate cancer. Let's begin the webinar now.
Hello, I'm Dr. Courneya.
Oh, hi, Dr. Courneya. I'm Larry White. This is my wife, Nancy.
Hi.
I'm on active surveillance with a Gleason 6, and I'm trying to do whatever I can with my personal lifestyle to keep this cancer at bay. We've already moved to a whole food, plant-based diet, and now we're coming to you to learn what kind of exercise might help in this endeavor. Do you mind if we record this session? Because if we don't, we probably won't remember everything that we've talked about.
No, please do. And it's a pleasure to meet you, Larry and Nancy. And Larry, maybe tell me a little bit more about your experience with prostate cancer and some of the questions you might have about exercise.
Okay, well, thank you. I will be 72 years old this month. So I've made it this far and relatively healthy. I've exercised on and off most of my life. When I found out I had prostate cancer, though, my anxiety level kind of went through the roof. Even though I had a relatively low Gleason 6 diagnosis, I became somewhat fatalistic, actually, or maybe just resigned. My father had prostate cancer and in the 1980s had low-dose brachytherapy. I don't really know everything around it, but his prostate cancer was not totally cured, and he ultimately died of complications to prostate cancer. But probably because of this, I was adamant that I knew exactly what I wanted to do. By golly, I was going to have surgery, and I was going to have that prostate taken out so I would not have metastatic disease. And I mean, that was it. I didn't need any more information. Fortunately, my wife, Nancy, was much more clear-headed than I was. And she began to research everything she could on prostate cancer and ultimately found ANCAN, started going to the sessions and began to learn a great deal. I didn't go initially, but she convinced me. Actually, people at ANCAN kind of guilted me to start going.
They thought he didn't exist.
They thought I didn't exist.
I was there without him for so many sessions.
but I started going. And through that, I was really well educated, began this process over the past year or so, being educated on all aspects of diagnosis and treatment, and began to understand that I had more options than just surgery.
Yeah.
In fact, I would probably die of anything else besides prostate cancer ultimately. So, you know, I just began to feel like active surveillance based on my history and my diagnosis, was the best choice for me, and I've pursued that path. But my anxiety level does remain in that I continue to have the idea that perhaps my prostate cancer might metastasize because I've gone too long with the active surveillance. And a short while ago, we were able to meet with Dr. Stacy Loeb about dietary issues. And based on her experience and research over the years, she felt like a whole food plant-based diet was probably the best type of diet. And we've been on that diet since as well.
Yeah.
So we know that you've done a great deal of research and experience with prostate cancer and exercise. And we've come to you to gain information and learn maybe what is the best exercise approach for me, hopefully to mitigate the prostate cancer. So how can exercise help a low-risk prostate cancer patient like me?
Thank you, Larry, for that background and that question. Well, when your father was diagnosed with prostate cancer, he would have not received any information about exercise or lifestyle factors. He would have gone strictly for the medical treatments. And of course, for many cancer patients, medical treatments are the most important thing they do, and lifestyle can also then be a kind of an adjuvant therapy for those patients. But for you, you're not getting any medical treatments. There are no treatments being given to help with your prostate cancer. So lifestyle is actually paramount. The good news is we've made a lot of progress, Larry, since your dad was diagnosed with prostate cancer. We've done dozens and dozens of exercise trials in prostate cancer patients. Now, many of them were in patients who are on active treatment, radiation therapy, androgen deprivation therapy, and so on. But more recently, we've started looking at the role of exercise in active surveillance patients like yourself. And I would say in terms of big picture, there's several key things that exercise may help you with. So perhaps the most important thing on your mind is, can it help slow the progression of the prostate cancer? And we do have a number of studies now suggesting that possibility. Exercise may slow the progression of the prostate cancer. And if it does that, that would allow you to remain on active surveillance longer or perhaps even indefinitely. So that's one of the big findings that I think is very important. The other big finding is you've talked a little bit about anxiety and distress. So in the studies that we've done, we've also shown that exercise can help active surveillance patients manage some of that anxiety and distress that comes with having a prostate cancer that's untreated. And some patients tell us that the psychological benefits of exercise are actually even more important to them than the disease-specific benefits. So it's really a powerful aspect of exercise for many cancer patients. And then the third very important factor, Larry, is, as you probably know, many active surveillance patients do need treatments at some point. So the disease may begin to pick up a little bit, progress a little bit, and you may be recommended treatments. So the role of exercise there is also very important. We call that prehabilitation. So preparing for these eventual treatments. Most cancer patients get diagnosed and go to treatments very quickly. They don't have a lot of time to prepare and get in shape for those treatments. But being on active surveillance, you'll have many months, if not many years, of being able to get yourself in the best shape possible for these treatments that may come: surgery, radiation therapy, hormone treatments. And we know that exercise can reduce surgical complications, it can reduce the length of hospital stay, and it can improve these outcomes after you receive these treatments. So just keeping yourself in the best shape for this possible eventuality. Mm-hmm. And the last a big picture benefit that I would talk about, as you mentioned, there's a very good chance you'll die from something else other than the prostate cancer, and that will likely be cardiovascular disease, diabetes, COPD, these other types of diseases. Cardiovascular disease is exercise's original claim to fame. That's right. The key thing that we've documented in the literature: to lower the risk of cardiovascular disease, lower the risk of heart attacks and other problems. So exercise has powerful effects on the cardiovascular system. So even if it doesn't help with the prostate cancer or some of these other cancer-specific outcomes, helping with some of these other disease-related factors is very important. So I think there's benefits across the board for a patient like yourself on active surveillance.
Dr. Courneya, it's so nice to meet you. How did scientists discover that exercise slows low-risk prostate cancer? What biomarkers are measured in your research?
Yeah, so some of the research is what we call preclinical research or research in animal studies. So the same way the drug developers will test their drugs initially in these rodent models where they'll inject a small number of prostate cancer cells or implant a prostate cancer tumor, and they'll give the animals the drug or not and see what happens. We do the same thing with exercise. So we've got studies in these rodent models where we inject some prostate cancer cells, but instead of giving these mice or rats a drug, we get them to exercise or not exercise, and we can look at how these prostate cancer cells grow. And what those studies have shown is the mice that exercise, the prostate cancer grows more slowly. So that's very helpful preclinical evidence to suggest that we're having some positive effect on those prostate cancer cells. The other way we do it more in human studies is we do studies where we get the men to exercise versus not, and then we put their blood or serum in a petri dish with prostate cancer cells. And then we can track how do these prostate cancer cells grow in the serum of men who have exercised versus the serum of men who have not exercised. And once again, we see the prostate cancer cells that are placed in serum of men who exercise grow more slowly than the men who didn't exercise, based on some of these biological things like immune cell factors, anti-inflammatory mechanisms, and other growth factors like insulin, IGF. So we know all these changes can slow the growth of these prostate cancer cells. And then the last way they've done it is more what we call observational studies. So just assessing men with prostate cancer in terms of their exercise levels and following long-term for actual clinical outcomes like death from prostate cancer and recurrence of prostate cancer. Now, those studies haven't been done in active surveillance yet, so we don't have these kind of observational studies. But in men with prostate cancer on treatments, the studies have shown that those guys who report higher exercise levels have a lower risk of dying from prostate cancer many years down the road, suggesting that it probably is, again, slowing the growth of those prostate cancer cells.
So the exercise itself produces biochemicals in the system that really does improve the immune system in general. Is that right? That might help again?
That's right. So there's very good, what we call biological plausibility. You know, exercise is not a hocus pocus type of therapy. It has strong biological effects. And when you engage in acute exercise session, it stimulates all sorts of changes, an increase in the number of natural killer cells, an increase in the activity of those natural killer cells, also T cells. As I mentioned, anti-inflammatory mechanisms are dispersed into the systemic blood system, and all these biological changes can then go and track down these prostate cancer cells anywhere in the body, including in the prostate. So exercise will increase kind of blood flow to the prostate and deliver some of these biological or biochemical changes right into the prostate and potentially slow the growth of those cells.
Causes one to certainly want to exercise.
Yeah.
So one other question I had was, does the PSA go down as well with all these other things going on? Do you see a PSA drop as well?
Yeah, great question, Larry. So in our study, we did track PSA, and we did see reductions in PSA levels, and these were men on active surveillance in the men who did the exercise, and also a slowing of PSA velocity, so how quickly the PSA is increasing over time. That's another very important biomarker suggestive that exercise might be slowing the progress of the prostate cancer.
Based on your research and everything, it seems like I probably would really like to be on a very good exercise program. So what would you recommend? What program would you recommend for me? Kind of describing the elements of that I could benefit from and reasonable to start.
You already garden.
Oh yeah, that's true. I forgot. I do garden, and I do like to go for walks in the forest. So, but
does it help?
Yeah, Absolutely. So there's a few general principles I can give you before we get into specifics. So one of the general principles in exercise science is some exercise is better than none. So even gardening, even walking, that can be helpful. In fact, a lot of the benefits are sort of moving from a completely sedentary phase into doing some activity. But the second principle is also important, and that is more exercise tends to be better than less. So a higher volume tends to produce more benefit. And by more exercise, it could be more frequently, it could be at a higher intensity, longer duration, and so on. The final principle we sometimes follow, Larry, is the best exercise is the one that you will do. So that is obviously key.
Right.
It's about motivation here. So you need to find an exercise that you say, I enjoy this exercise. It's something I'm going to continue to do. The way I encourage patients to think about it is don't come up with an exercise program you're going to do for the next 6 weeks or the next 3 months. Come up with something you're going to do for the rest of your life. So it has to be feasible. It has to be realistic for you to do, because I want you doing this exercise program well into your 80s and beyond. So with those general principles, what do we recommend? Well, the typical guidelines, including for prostate cancer patients, is about 150 minutes a week of aerobic exercise or cardiovascular exercise. So that can be your walking, jogging, cycling, and so on. So about 2.5 hours of that. And you can get that different ways. They encourage you to spread it out over the week, not try and do it all in one day, but spread it out, typically at least 3 days per week, but up to 7 days a week as well. And then on top of that aerobic exercise, we do recommend strength training. So we call those the combined exercise guidelines, aerobic exercise plus strength guidelines. And these can be body weight exercise like push-ups and sit-ups and those types of things. But oftentimes it's the weight training exercise. And that can be really beneficial for patients. And there we recommend that 2 to 3 days per week. That's a lot to ask. So, 2.5 hours of aerobic, couple days of strength training, that already is quite a bit to ask. Are there more benefits even beyond that? There are. So the guidelines say even just 2.5 up to 5 hours a week of aerobic exercise. There's still additional benefits. The benefits of exercise don't really plateau until you start to get into half marathons and marathon runners, where you're saying this is a very high volume of exercise where there's probably no really further benefits. And in fact, in rare cases, too much exercise can occur. But for someone like yourself, you've got this sweet spot of 2.5 to 5 hours a week of moderate intensity to vigorous intensity exercise, and 2 to 3 days per week of weight training, if possible, if that's feasible. But less than that is also beneficial. So even your walking program and your gardening program is likely to be beneficial.
Well, yeah, so what would low intensity look like? How fast would I need to walk, and kind of low intensity, and then what would a high intensity workout look like?
A casual walk, we would call that kind of a low intensity exercise. And typically you can look for things, like light sweating, and you want to notice an increase in your breathing rate. Can you notice that your heart rate's beating faster and your breathing rate is increasing? If it's not, then that's probably your light intensity exercise. You're out there gardening. You can carry on a conversation while you're doing the activity. Once you get to moderate intensity, you'll notice some of these physiological changes. You can tell you're having to breathe a little bit harder, your heart rate's up. You can still carry on a conversation, as they say. You can talk, but not sing, because you're sort of trying to get air into the lungs to get the muscles oxygenated. The higher intensity exercise is typically something like running. So once you get into that higher intensity, you're really focused on your breathing. You notice your heart rate is up substantially and they're sweating. And even carrying on a conversation is not very comfortable. You want to just focus on keeping a regular breathing rate. So that's kind of physiologically how we know you're getting into a higher intensity exercise.
You go to YouTube these days, and there's so many different types of exercises. I guess I need to go to a trainer. Probably that might be beneficial, although I don't know how many trainers are familiar with prostate cancer and active surveillance, that sort of thing. But when I think of the zone training, zone 2, zone 5, the various ways that cyclists train and that sort of thing, versus HIIT. And can you explain at least the HIIT program? And
Yeah.
I would assume that's pretty high intensity that one would look at for the high intensity.
The HIIT training we call high intensity interval training, and it's really just trying to get in short bouts of higher intensity exercise while you're doing kind of lighter or moderate intensity exercise, because it's hard for people to maintain high intensity for a long period of time. Yet we know that type of exercise is very beneficial for patients. So it's kind of like a bolus or a short burst of energy expenditure that really stirs the biological soup and gets a lot of these biochemical changes going. So for someone like you, Larry, it would be very easy. So you mentioned you already love to walk. So you go out and you walk for a couple minutes at your casual pace, and then you walk briskly for 1 minute. And then you might walk at your casual pace for a couple minutes and then briskly for 1 minute. So this is what we mean by altering the intensity. And then once you get up to it, you could walk for several minutes and then jog for 1 minute. And then walk for several minutes, jog for 1 minute. So these are kind of these short little intervals that you do, and allows you to build up gradually and also get some of these benefits of this higher intensity exercise without having to maintain it for 30 or 45 minutes continuously.
So that sounds reasonable. I mean, so for me, an optimal program, assuming my knees are okay, hips, my musculoskeletal system's okay,
Yeah.
What would you think of for me as an optimal program?
So I combine optimal and feasible. So, 3 days per week is really ideal. I think it's hard for people to exercise every day. Now, stuff like walking every day is fine. So this is where you're not changing your clothes, you're not showering afterward, you're just out walking, casual walking outside or in the mall or getting groceries. So that type of activity can be done every day. But in terms of an exercise training program, I'd say 3 days per week. And this is a program where you're going to change your clothes before you do it, and you're going to have to shower afterwards because you're working up a good sweat. And this is where you can do some of this interval training outside while you're walking if you want, treadmill, cycle, stationary bike, elliptical, whatever you prefer. And so 3 days per week, I think, is fine for that. For the weight training, we say 2 to 3 days per week. So even 2 days per week of weight training, and we've done these studies in prostate cancer patients, improves strength, it adds muscle mass and improves quality of life. And so feasibility, Larry, it's easier to sort of combine your weight training with the same time you do the aerobic exercise. So again, it's still 3 days per week, but 2 of those days, in addition to your sort of aerobic workout, you'll add some of this weight training. And typically we recommend, all the major muscle groups covered. So the shoulders, the chest, the stomach, the quadriceps, the hamstrings, and so on. It's about 8 different exercises, and you can do a couple sets of those different weight training exercises. And normally we recommend anywhere from like 8 to 15 repetitions. And what that means is by the time you get to 15 repetitions, you should be fairly tired. If you're still whipping the weight up at 15, 16, it's too light. If you can't do 8, so in other words, you get to 5 and you're done with it, it's too heavy. So somewhere in that 8 to 15 range where you start to fatigue, and then that's a good weight for that particular exercise. So that's be a great program, Larry, that would have all sorts of fitness benefits, functional benefits, quality of life benefits, and yes, possibly slow the progression of the prostate cancer, prepare you for any potential treatments down the road, lower your risk for cardiovascular disease as well.
In starting this, for someone that doesn't have much experience, would you recommend going to see a trainer? And what is the best environment to exercise in if there is one?
So yeah, seeing a trainer is fantastic. This will be an expert who can assess your fitness level and see what is good for you in terms of starting, and see, what muscles are weak, what muscles are strong, what type of program might be good for you. So if you have a little bit of money that you can go and get a formal fitness test done and get an exercise prescription, it's a great start. The best environment, that's a really important question, Larry, because we typically recommend exercise from an exercise physiology perspective, not an exercise psychology perspective. So the exercise physiology perspective says the environment doesn't matter. If you're jogging, there's going to be physiological changes, and it doesn't matter if you're out jogging in a beautiful park or hiking trails or you're in your basement on a treadmill with a 60-watt bulb in a dark room, right? Physiologically, those changes are the same, but we know psychologically it can be very different. And so the psychological benefits can be driven more by the physical environment, the social environment, exercising with other people as well. So yes, you talked about a plant-based diet. I recommend plant-based exercise. So this is exercise that's outside in the hiking trails, going through parks, and other kind of beautiful environments. And you'll find that the psychological benefits of that exercise is even more profound, and the motivation and adherence to do it can also be much higher. So find an environment that you like, and if it's feasible to do that, that's great.
I read that about 50% of men on active surveillance have emotional distress issues, such as anxiety and depression, and 10% of the cases are to the point that they are considering aggressive treatment that they might not need because they're so anxious. Can exercise help these patients cope with their distress levels?
Yeah, so we looked at that in our study of men on active surveillance, and we really found some important psychological benefits in addition to the biochemical benefits. And so we found the men that did this was a HIT training program, Larry, so similar to the one that I described to you. They had lower anxiety related to their prostate cancer. They had lower perceived stress. But perhaps most important of all, they even had lower anxiety related to their fear of cancer progression. So this, of course, is a big psychological factor for cancer patients. You've got the prostate cancer and this distress over whether or not it may progress. And this can ultimately, as you said, Nancy, it can drive these men to say, give me the treatment. Just take the cancer out, get rid of it. I don't want to deal with this stress. But we found that it improved or lowered their fear of cancer progression. And so we hypothesized from that might help these men stay on active surveillance longer if they're not as distressed about having the prostate cancer. And as I also mentioned, Larry, many of the participants in our study say these psychological benefits to them are just as important as the physiological and the cancer-related benefits. And some of them will say, exercise helps me feel normal. And they say everything about cancer is not normal. But when I go out and exercise, I feel like my life is normal again, and I'm on my own routine and doing things. And that can be, I think, psychologically relaxing and enjoyable for these men. So yeah, very important psychological benefits from these exercise programs, especially, if you get out into a nice physical environment, or you're exercising with your spouse or with other men on active surveillance and stuff as well, that can also add to some of the psychological benefits of exercise.
Right. So the relationship piece, as well as the environment, are just an additive effect that can be very beneficial for the person's overall.
That's right. Yeah, when we ask patients, what makes exercise fun and enjoyable, they'll often talk about the social interaction that happens. They'll talk about the pleasantness of the environment. And the other way, Larry, I don't know if you have any interest in sport at all, but sport is another great way of making an activity fun, whether you like playing soccer or basketball or golf or other recreational activities. Incorporating a little bit of a sport component can really make the activity enjoyable as well.
That's good. I used to joke, I feel perfectly great when I'm watching soccer and football on TV in my easy chair. I just don't have any pain, and it's pretty nice. But you're telling me that's not really the best approach, I think. Get out there and engage in the sport. Yeah.
That's right. Yeah, absolutely.
We have some younger friends who are also on active surveillance. Do you recommend the same exercise program for older men, say 70 years and older, that you recommend for younger men, 50s and 60s, or might those programs vary a bit?
Yeah, we generally make the same recommendations, but one of the key things is, we typically will recommend exercise based on fitness levels more so than age. So you can have some of these younger guys who are in very poor shape, and it might be a very different prescription. You can have men in their 70s who are very fit. There's guys out there who are running half marathons and full marathons in their 70s and even into their 80s. So a lot of it is, what's the health condition of the patient? What kind of shape has he kept himself in over these many years? Having said that, generally, as you age, you become less fit. So older men are certainly at risk of being less fit and less healthy than these younger men. So usually we have to take those factors into account more so for older men than younger men. But in terms of the aerobic guidelines and strength guidelines, they're very similar. The one main difference, Nancy, is for older men, we also recommend balance exercises. The risk of falling is a very important issue in older patients, and exercise can really help with balance. So there's specific balance exercises you can do, such as standing on one leg, heel-toe walking, where you place the heel and toe attached to each other while you're walking forward, walking backwards, and other activities, even doing something like bicep curls while you're standing on one leg. So there's a bunch of these different balance exercises that can be very important for patients maintaining balance, especially while you're exercising, because exercising can sort of be a risk for falling as well. So you want to make sure you've got good balance as you get older.
Oh, absolutely. So it sounds like, you want to do the aerobic piece, strength training, and really balance and work on functional kinds of exercises, which you're going to need getting older, right? Getting up off the floor, taking care of dishes, just being able to engage. Carrying thank you. Yeah. Carrying the groceries, just really being in the best possible condition that you can be in, not only for cancer, but just well-being and the longevity that we're going to have.
Yeah, as one of our famous exercise scientists said, Larry, everything that gets worse with aging gets better with exercise. So This is the way you can think about it. Yeah.
Well, thank you so much for your time, Dr. Courneya. We really appreciate it. We've learned a lot.
Yeah, it was a pleasure meeting you, Larry and Nancy. And Larry, best of luck with your exercise program.
Well, thank you. Might have to be back in touch with you, though. And as I lose my way, I used to joke that I exercise to the point of glistening. If I begin to glisten, I back off. And you're telling me that's not the right approach. So
that's not necessarily
you can do it, Larry. Keep me posted on things.
Do you think we've come away with what we need, or do you think that we left something out or didn't think of a question to ask, or, as we try to figure this whole process out?
No, I think there's lots of excellent questions, Larry, that a lot of men have who are on active surveillance. So, I think the key thing is primarily you want to manage that active surveillance and you want to manage it physiologically as well as psychologically to avoid these treatments for as long as possible, and then be in the best possible shape if you do need treatments at some point. And then, yes, keep in mind cardiovascular disease, diabetes, and these other things as well that exercise can help with. So exercise is really, one of these key behaviors that you engage in that will help with so many aspects of functioning, quality of life, and disease management. There are many, many websites. So you can go to the American Cancer Society. You can go to the American College of Sports Medicine. ASCO, the American Society of Clinical Oncology, now has exercise guidelines. Even the prostate cancer foundations now have exercise guidelines out there that will summarize a lot of these key points that I've discussed.
Thank you so much. It's been incredibly helpful, and I am ready to mend my ways and
me too.
Get into it with her. We'll exercise together as well. Thank you so much.
Fantastic. Thank you again.
A special thank you to Larry, Nancy, Dr. Courneya, and all involved in today's presentation. We hope you found actionable takeaways from this presentation to aid in your prostate cancer journey. Thank you for attending.